There has been a great deal of research regarding cancer and how we can help ourselves reduce our personal risk of developing this dreaded disease. In this video, I will share a study about a very simple activity that all of us do every day. Just by tweaking it a little and changing the way we go about this activity, we can reduce our risk of cancer, including breast cancer. Are you ready to find out more about this? In truth, I was very surprised that this activity has been studied in relation to its ability to cause a reduction in breast cancer risk. If I, as a medical professional, was surprised, I am sure that this will surprise you too. So, let's look at further details. The lead investigator for this study is Dr. Jonathan Mack, who led a 5-member international team. There were researchers from Hong Kong, Sweden, Finland, and the United States of America. This study was published in 2025 in the Journal of Cachexia, Sarcopenia, and Muscle. Who were their study participants? The researchers included 431,598 individuals who were registered in the UK Biobank database and another 1,311 participants from the Hong Kong osteoporosis study. They included participants from different countries to allow generalizability of the findings. At this point, you may be asking, yes, we know that there were a total of 432,909 participants in this study, but what activity were they researching? Well, here it is. These doctors were researching the speed of walking and risk of cancer in 2 prospective cohort studies. This is what we already know about physical activity. It is a well-established protective factor against various cancers, including lung, colon, breast, and liver cancer. Walking is the most common and accessible form of moderate physical activity and has been a key focus in promoting physical activity. Recent research has also demonstrated an inverse relationship between daily step count and step intensity with the risk of cancer incidence and mortality. This means that the more we walk, the more we lower our risk of cancer. However, whether walking speed per se is associated with cancer incidence remains poorly studied. This is the reason why these researchers embarked on this study. So how was walking speed calculated in this study? In the UK Biobank, walking speed was self-assessed. Those who considered themselves slow walkers were estimated to have walking speeds of less than 3 miles per hour, which was approximately 1.23 meters per second. Those who walked at average speed were considered to walk at 3 to 4 miles per hour, or 1.34 to 1.79 meters per second, while brisk walkers were estimated to walk at speeds of greater than 4 miles per hour, or quicker than 1.79 meters per second. The participants from the Hong Kong osteoporosis study underwent a timed 6-meter walk test. The average walking speed was then calculated from the time taken to complete 6 meters. A walking speed of less than 1 meter per second was considered indicative of low physical performance. Many other characteristics of the participants were also studied, and the researchers made appropriate adjustment when performing statistical analyses. This is a Kaplan-Meier curve, which is a graph representing the statistical analysis of the chance of developing cancer against walking speed with respect to this study. In this case, the y-axis represents the development of cancer, while the x-axis indicates the time that has elapsed from the beginning of the study. We can see that with time, the risk of cancer was inversely proportionate to the walking speed. In other words, the slower the walking speed, the greater the chance of developing cancer. Compared to participants who walked at a speed of less than 1 meter per second, individuals who walked at a speed of more than 1 meter per second had a reduction in risk of any cancer by between 44 to 48%. This is derived from the observation that after adjusting for other factors, using the risk of cancer for a slower walking speed being the reference point of 1, individuals with a faster walking speed had a hazard ratio, or HR for short, for developing cancer of between 0.52 to 0.56. Having already seen the results presented in graphs in a table, I'd like to summarize the findings of the analysis in words. The researchers stated that individuals with a faster walking speed had lower probability of developing any cancer. In conclusion, the study provided new evidence that a faster walking speed is associated with a reduced risk of developing any cancer. What does this mean for you and me? It means that walking at speeds in excess of 1 meter per second on a regular basis can result in a reduction of developing cancer by between 44 to 48%. While further research is needed to confirm these findings, these results suggest that, in addition to emphasizing the amount or duration of walking, increasing walking speed could provide additional benefits in reducing cancer risk. So the everyday activity of walking can help us reduce our cancer risk. My specific interest is breast cancer, and since this condition was included in this study, I can confidently say that walking on a daily basis can help reduce the risk of breast cancer. However, as I have learned from this study, it is not simply leisurely walking which will help reduce our risk of cancer, but walking at a speed of more than 1 meter per second, which is at a pace quicker than 3 miles per hour. Thank you for watching until the end of the video. If you have found the information useful, please like, share, comment, and subscribe. This is the first video of many sharing how we can use everyday activities or events to help us reduce our risk of cancer, with a special focus on breast cancer. So I hope you will join me in my next video when we will explore another daily activity: eating. Until we come together again, keep walking and take care. Cheers.